I was first diagnosed with Crohn's when I was 12 years old. And so prior to that, I had so many other GI symptoms that I just couldn't identify or just didn't know were per part of Crohn's. And so when I was diagnosed, I was unable to gain weight, unable to grow. I was shorter than all the other kids in my grade, and I was really emaciated. Like, you could see all of my ribs. So Crohn's impacted my life in a lot of ways. I mean, there are the things people think about kind of offhand, like, oh, you're going to have digestive distress, you're not going to be able to eat certain kinds of foods and those sorts of things. But Crohn's also affects other kind of aspects of your life too. Like, it affects your mental state, your energy. A lot of people with Crohn's, like I did, experience some extreme fatigue. It was just difficult, to try to live normally. Speaking to my GI doctor and talking through some of these other options, my GI physician recommended that I go with Skyrizi and the SmartDose device, just because it's a biologic that's localized to the areas where I need it to be, versus something that I was had some concerns about other, and the effects of other drugs being more generalized to the rest of the body and kind of susceptibility to infection and all those kinds of things. And then, of course, is the advantage that Skyrizi comes with the SmartDose device, which means that instead of going to a center every 8 weeks and having to block out 2 hours of time, as I know some friends with Crohn's have had to do, and sit there and have your infusion, and then with all kinds of other side effects and things, it's like you with Skyrizi you can just get this device to your door, slide your medication in there, it clicks, you close the door, and then you just pull off the adhesive and put it on, and then that's that. You push a button, and then in 5 minutes it's done, and then it comes again in the next 2 or 3 months. It's just a lot easier to fit into your life. Like, to do the SmartDose device, because I work from home, I can put it on my leg and then, push the button, and I can just be answering emails while the device is running, versus, say, going to an infusion center and you're trying to block out that time, and then you have to find a time to fit in their schedule. And so it's just a lot easier to stay on track with my disease maintenance.
We don't want to add burden to our patients, right? And we also have to remember that patients don't want to be reminded that they have a disease every day. So if we can come in and provide the solution with a delivery device that's very simple to use, that delivers the medication accurately and reliably, what a burden that takes off from the patient. So for many of those reasons, I think it's important for us to innovate and to listen to patients like Carter. But I think just as important, it's helpful to understand the impact that our device has had on this patient.
That's absolutely critical that it works kind of every time, and works the first time too, because when you're injecting something into your body that's going to have a significant effect on how you feel and of your experience of life, you want to know that that's going to work. And when I use a SmartDose device, I don't have any concerns about whether or not it's going to work. So being able to have that sense of empowerment and to feel like I have so much control over my disease with the SmartDose device helps a lot.
Our work is meaningful. Our work is having an impact. Our work matters, The drug is the drug, right? That drug could have been given, again, in the hospital as an IV infusion. It could have been given, with a pre-filled syringe or an auto-injector. But to be able to have our device for patients that have a fear of needles, patients who have a fear of complexity of the devices, I think really makes me feel like we hit all of the marks as far as providing a valuable solution. And again, this is not just about treating the patients, but it's that whole therapeutic experience. I'd like to say that we're giving these patients back their lives.
Thank you to you guys, everybody at West Pharma, for the work you do with the SmartDose device, and just trying to make it easier for people like me to manage Crohn's disease, and then kind of like me to not have to deal with Crohn's, which can be a huge burden on your life, and really improve your ability to connect with friends and family, and just engage with life in a positive way. So that's absolutely huge. Yeah, thank you.